Hey friends, today I want to talk about something I see all the time in the Facebook groups, the Valley Fever Facebook groups, and it honestly breaks my heart. Someone will post a picture of their dog who was recently diagnosed with Valley Fever, or maybe the dog has been sick for a while, and that dog looks absolutely pitiful. They look weak, they look exhausted, worn out, and they're lying flat on the floor, maybe with that sad, painful look in their eyes, grimacing, maybe refusing food, maybe barely wanting to move. And the person posting it is scared and heartbroken and asking, "What do I do?" And I understand that feeling. I really do. When your dog has valley fever and they are down and out, it can feel incredibly overwhelming. It can feel like you are watching your dog disappear right in front of you. You do not know if they're painful, and you don't know if they're nauseous, and you don't know if they're depressed, and you don't know if the medication is helping or hurting. You don't know if this is part of the disease process or if something else is going on. And when you feel helpless, of course you reach out for help. But today I want to shift that feeling from helplessness into action, because there are actually a lot of things you can do at home to help your dog get over this awful hump. And I want to be really clear that I'm not saying that you should ignore your vet. I'm not saying you should avoid conventional medication. And I'm not saying valley fever is something you can just fix with a little bone broth and sunshine. Valley fever is a serious fungal infection, and it can be severe. It can disseminate. It can affect the lungs, bones, joints, nervous system, eyes, heart, kidneys, and other organs. And dogs need antifungal medication. They need pain medication. Some dogs need appetite support. Some dogs need hospitalization, and some dogs need a lot of help. But what I see over and over again is that people get the diagnosis, they start the fluconazole or another antifungal medication, and then the dog is just left lying there feeling terrible. The dog's not eating well. He's painful. He's nauseous. And the dog has no joy. The dog doesn't move, and there's no comfort plan. The dog has no immune support, and the human is just waiting for the fluconazole to magically turn everything around. And that's not how this works. Fluconazole is not a magic wand. It is one tool. It is a very important tool for dogs with valley fever, but it's not the whole thing. If your dog is down and out, we have to ask, why does this dog feel so bad? And then we have to start addressing those pieces one by one. Your dog may feel terrible because valley fever itself makes them feel like they have the worst flu of their life. They may be exhausted because their immune system is fighting a serious fungal infection. They may have a fever. They definitely have inflammation, and they have pain in the lungs, in the bones, in the joints, maybe even in the muscles. They may be nauseous from the medication or just from the infection itself. They may be nauseous from not eating or from all of this. They may be anxious because they don't understand why they feel so sick. Or they may be emotionally shut down because their whole world has suddenly gotten very small. So when I see a dog lying there looking pitiful and the pet parent says, "What do I do?" My answer is, start helping the dog feel better in every way you can. Not in a frantic way, not in a panicked way, not in a way where you throw 50 things at the dog overnight, but in a thoughtful, supportive, common sense way. So first, let's talk about food. Please don't keep putting down the same bowl of kibble and hoping your very sick dog is eventually going to eat it. A dog with valley fever who does not want to eat dry, processed food is not being stubborn. They're being honest. They're sick. And that kind of food is horrendous for any dog. They may feel nauseous. They may have a fever. They may have stomach cramps from the medication. And they likely have pain. Their body is inflamed. Their immune system is under attack. And dry kibble may be the least appealing food in the world to that dog. So this is the time to offer real food, now and forever. I want you to think in terms of warm, nourishing, easy to eat, highly aromatic food. Meat, eggs, organ meat, soft cooked vegetables, bone broth, warm homemade food, something that smells good, something that has moisture in it, something that actually gives the body usable nutrients. A sick dog needs nutrition. They need protein. They need minerals. They need fats. They need moisture. They need food that supports healing instead of just filling a bowl. So try offering small meals instead of one big meal. Try hand feeding. Maybe sit with them. Try changing texture of the food or making the food smell really good with whatever it is they like. Bone broth can be very helpful because it's soothing, nourishing, and easy to get into a dog. You can just top food with it, or you can have them drink it, or you can even syringe it gently to them. It contains collagen and gelatin, which can help support the gut lining. And most dogs with valley fever have gut problems. They may have leaky gut. They may have dysbiosis. They definitely have chronic inflammation, and the pharmaceuticals will damage the gut further because gut health is directly connected to immune health. So supporting the gut is not some random side project. It is a big part of supporting the immune system. Another really simple food tool is garlic, used appropriately. Let me grab my garlic dosing for you. There we go. So that's a handout for dosing your dog with garlic, because garlic is an herb. It's a taste enhancer, and it can make food more interesting to a dog who's not eating well. And it also, bonus, has antifungal and anti-inflammatory properties. And this may be a surprise to you, but it's not toxic. Inappropriate amounts, contrary to some opinions out there. The studies that were done to say that garlic was toxic used extremely high doses that would probably make anyone die. So it was really a poorly done study. So that's where that information came from. Garlic is an herb. It's not toxic at the right dose. All right. So for garlic, for example, a 50-pound dog might get about, a small clove a day. And you can mince it or crush it, and then you let it sit for 15 minutes, and then you mix it into the food. And letting it sit allows the chemical constituents to combine and produce those beneficial compounds that are medicinal. And that's what we want. So it smells good and it's an appetite stimulant. But we want the medicinal properties too, because it's antifungal. So that's a huge bonus. So you can start with less than that and see how your dog tolerates it. So for many dogs, a small amount of fresh garlic can be really helpful. So now let's talk about nausea. A lot of these dogs are not eating because they're nauseous. They may not be vomiting, but they still feel sick to their stomach. Dogs do not always tell us they're nauseous in obvious ways. They may just turn away from the food. They may lick their lips. They may drool. They may swallow hard. They may sniff the food and walk away. They may look interested for 1 second and then suddenly act like the food is disgusting. They may eat one thing one time and then refuse it the next time. That's not them being difficult. That's nausea. And nausea has to be addressed. There are conventional anti-nausea medications, and sometimes those are absolutely appropriate. But there are also gentle things that you can do at home. Things like ginger tea. Ginger tea can be very helpful for nausea. Think about it. They sell ginger capsules for people with nausea, or on boats when they get motion sickness, or to prevent motion sickness. Chamomile tea can also help calm the stomach and also calm the nervous system. So you make the tea, you let it cool down, and then you mix a little with the food, or syringe a small amount into their mouth if the dog will tolerate that. We don't want to stress them out. And you use a 1/4 cup of tea, brewed tea, cooled down, for every 25 pounds of body weight of your dog per day. And you divide that into small amounts or small frequent amounts over the day. So you can use these teas as part of a little supportive routine. A small amount of cooled ginger tea for nausea, a small amount of cooled chamomile tea for tummy calming and relaxation. These are things many people already have in their kitchen cabinet. There are also homeopathic remedies that can help with appetite and nausea, depending on the dog's exact symptoms. But remedies like Ipecac 30C or Antimonium 30C or Colchicum 30C can be considered in certain situations. And those are generally over the counter, at your natural food stores. And with homeopathy, these are homeopathic remedies. These are not one size fits all, and homeopathy works best when the remedy matches the patient, but they can be useful tools and you can try them. Honestly, it's not going to hurt. The main point is this: if your dog is not eating, don't just keep offering the same food and hoping. Ask why. Are they nauseous? Are they painful? Do they have a fever? Is the medication upsetting their stomach? Is the food unappealing? Are they emotionally shut down? Then start solving the actual problem. So now let's talk about pain, because this is huge. Valley fever is extremely painful. Hard stop. I can vouch for this. I've had it in my lungs. I've had it in my knee joint. It is excruciatingly painful, to the point that I was in tears both times I got valley fever. That's how painful it is. In fact, I have said before that the pain in my knee from valley fever was probably worse than childbirth. Not kidding. These dogs are in pain. So if it's in their lungs, their chest hurts. It's like somebody is crushing your chest when you have valley fever in your lungs. And if it's in the bones or joints, excruciatingly painful. So if the dog is lying around all day, they're probably painful from one of those or both of those or any of those. And then even muscle soreness and stiffness can develop just from lying around all day. Or if they're coughing a lot, that can cause chest pain. They can become sore from the coughing. If they have a fever, their whole body can ache. They feel like they were hit by a truck. And honestly, that's how it feels. I've had it twice. And then pain suppresses the appetite. Pain suppresses movement. They just want to lay around and not do anything. And it suppresses joy. It makes dogs look depressed. It makes dogs withdraw from the family. And the pain makes dogs stop interacting. And the pain makes people think that their dog is giving up when maybe the dog is simply hurting. So if your dog is lying there looking miserable, pain has to be on the list of things that you address. And there are conventional pain medications, and sometimes they're needed. And I'm not against that. I would rather have a dog on appropriate pain medication than see a dog suffer because everyone is afraid of pharmaceuticals. Pharmaceuticals are not always the best answer, but unmanaged pain is not acceptable. So sometimes you may need to go to your vet and get carprofen or gabapentin or amantadine or some kind of opioid or other medications depending on your dog and the situation. So that's between you and your vet. But there are also natural pain support options that can be very helpful. And in some dogs, they work beautifully. In fact, most dogs, they work beautifully. And they can be combined with the pharmaceuticals if you're going that route. And if you combine the natural ones with the pharmaceuticals, it usually helps you reduce the dose of the pharmaceuticals, which will reduce the chance of side effects from the pharmaceuticals when you're combining things. So one of my favorite options for pain is Arnica Montana 30C or T Relief, which has Arnica Montana in it, and other additional homeopathic remedies. This is a homeopathic remedy. It's over the counter, and it's used for pain, trauma, soreness, bruising, inflammation. And I have some clients tell me that it works as well as carprofen, which is amazing. So does that mean that the homeopathic products replace every pain medication in every dog? No, but it doesn't hurt to try, and it's over the counter and readily available. So if your dog, if you give your dog T Relief or Arnica Montana 30C and your dog gets up, looks brighter, eats better, moves better after you've addressed the pain, that tells you something very important. It tells you that your dog was painful. There are also herbal pain formulas. One example is Body Sore. This is a Chinese herbal formula I love. It is anti-inflammatory and analgesic, and the herbs in it work synergistically to safely address pain without side effects. Let me grab a QR code for you for Body Sore. So this is a really nice formula, and it's actually got some fabulous herbs in it, including corydalis. And corydalis is one of the herbs they use in people for intractable cancer pain. So it's a strong combination of herbs for pain and inflammation, and it's safe. And you can combine it with the pharmaceuticals if you need to. All right. All right. Another one is PEA. This is another supplement that can be layered in for pain and inflammation. and it supports the body's own endocannabinoid pathways, which is the same pathways that CBD uses. But this is not CBD, it's PEA. And so this can be really useful for chronic pain and nerve pain. So we just mentioned endocannabinoids. You can use CBD. CBD can be extremely helpful. It relieves pain, inflammation, anxiety, and really provides overall comfort. And anxiety can be a big part of what's going on with your dog. But the quality of the CBD product matters tremendously. And there's a lot of junk out there. So I only have like 2 or 3 products I like, or companies that I like. Let me show you one of my favorites. This one is called CBD for Dogs. And this is a nice one. And you don't need much. You start with just a small amount and see how your dog does. Okay. So let's talk about anxiety, because the CBD will help with that. So we often focus so much on the valley fever infection that we forget the dog's emotional state. So imagine your dog was active and happy and eating and playing, and then suddenly they feel sick, weak, painful, and nauseous. They don't understand what's happening. They don't understand why they can't do what they used to do. And they don't understand why everyone is worried. They feel that. They may feel anxious because they're immobile and sick. So, emotional support matters. And one of the easiest ways to support your dog emotionally is to change the scenery. So, if your dog can safely go outside, get them outside, get them into the fresh air, get them into the sunshine, let them smell the yard or sit on the porch or lie on a blanket under a tree. Let them watch the world. Let them feel like they are part of life again. So if your dog can't walk, use a wagon, use a stroller. Use a sling if appropriate, but help them get outside without exhausting them. And, use your common sense. And if they can walk a little, let them walk a little. Maybe it's just to the mailbox and back. Maybe it's just around the front yard or the backyard. Maybe it's just a slow sniffing walk for 3 minutes. That's still really significant. So don't underestimate the power of a tiny adventure. Dogs live through their senses. They want to smell things. They want to be with us. They want to be included. A dog who is sick and stuck inside all day may start to look sad, not just because of the disease, but because their entire world has collapsed into a bed and a food bowl. So bring life back in tiny, manageable pieces. If your dog used to love playing ball, don't make them chase a ball. But maybe roll that ball gently to them while they're lying down. If they want to chase a ball, maybe you can, just toss it a short distance, but don't overdo it. Maybe let them hold the ball in their mouth. Maybe they wag their tail and feel like themselves for 10 seconds. That matters. If your dog loves treats, offer treats. If they have a favorite toy, bring the toy. If they like being brushed, brush them. If they like sitting outside with you while you're drinking tea or coffee, do that. If they like car rides and they can tolerate it, maybe a short car ride with the windows cracked is the best part of their day. This is not silly. This is quality of life medicine. Now, let's talk about some physical therapies. It doesn't have to be fancy. Let's talk about massage. Gentle massage can be incredibly helpful for sick dogs. And I'm not talking about like deep tissue work. And I'm not talking about forcing your hands into painful areas. I'm talking about just gentle, calming touch. A sick dog who has been lying around may have tight muscles or sore shoulders, sore hips, a sore neck, or even tension from guarding painful areas. So gentle massage can relax the muscles, it can improve circulation, and it can calm the nervous system. It reduces anxiety. It can help the dog feel safe. It can also help you connect with your dog in a way that is not just giving pills or trying to force food and worrying. So start slowly with massage. Watch your dog's body language. Use soft hands. Work around the neck and shoulders and back, maybe the hips and the legs if they enjoy that. But if they move away or tense up or pant or lick their lips or look uncomfortable, just back off. It's not something we do to the dog. This is something we offer the dog. Massage should feel good. Another home therapy that can be powerful is acupressure. So acupressure is when you apply gentle pressure to the acupuncture points, and you're stimulating the same points that we use in acupuncture, but instead of using needles, you're using your fingers. And this can be done at home. There are acupuncture points or acupressure points for pain, for immune support, for fever, for coughing, for nausea, for weakness, for supporting the lungs, for digestion. And there are even points that help the body expel pathogens. And in Chinese medicine, valley fever is a pathogen that has invaded the body. And this isn't a wimpy therapy. So acupuncture and acupressure can be super powerful. And I've seen dogs respond beautifully to acupuncture points and acupressure, even when they're very sick. Acupressure gives you something that you can actually do with your own hands at home. You don't need to be perfect. You don't need to know every point. You can learn a few useful points and then use them gently and often. The goal is to support your dog's body, not overwhelm it. So let me show you my my Conquering Valley Fever book. So I wrote a book about valley fever. And when you get the instant download, which is this QR code goes to the instant download of my Conquering Valley Fever book, you get a free healing toolkit. And in that free healing toolkit are acupressure points that I show you. I show you where they are and how to do it and some of the patterns I use. So check that out. All right, so another modality that can be used at home is laser therapy. And this can help reduce pain and inflammation, support tissue healing, improve the circulation, and help the body recover. So it's commonly used for arthritis and injuries and wounds and arthritis pain. So dogs with valley fever, using the laser has to be thoughtful because we need to know where we're treating and why. But for many dogs, laser therapy can be a valuable part of getting comfortable and a big part of the healing plan. So your vet clinic may offer laser therapy. I actually have lasers for rent, and they're shipped by UPS to you. And then when you're done, you can rent it for a week or 2 weeks or a month or longer. And when you're done with it, you ship it back. UPS, they give you a shipping label. It's a prepaid shipping label, and you ship it back when you're done. All right, so a dog who needs support may benefit from regular laser therapy at home than from just like once in a while at your vet. So I would consider that. And if you're interested in renting a laser, just comment below or email me. And you can go to my website, drpameladragos.com, and you can contact me there also. Another physical modality that I love that you can do at home is PEMF, post-electromagnetic field therapy. So you may have seen the PEMF mats or the loops like the Assisi loop. But PEMF uses healing frequencies, so electromagnetic frequencies that are at healing levels to help normalize cells. And a simple way to think about it is that it helps cells return to a healthier electrical and energetic state. So it's used for pain, inflammation, arthritis. It's used post-operatively for healing and also for chronic painful conditions. It can be very calming also, like they use it for anxiety. And it can be a real helpful part of your dog's support plan. I think I have a QR code for that too. Let me look. There it is. So I like the Respond mats, and they come in different sizes. So if you have a big dog, you get the big mat, and if you have a little dog, you get the little mat. But they basically just lay on the mat as if it was their bed, and you just press the button on, and there's 3 different settings, and you'll start low and then increase. You can also put the PEMF bed under their regular bed, so they don't even know it's there, and you can still turn it on and use it for them. So it's really cool. I like this, and I think it's really effective. And when you're treating a dog on a mat, their whole body gets a treatment, which is what they need. Okay. So another thing that's out there is rehab and physical therapy. So this can be wonderful, but timing matters. So this is not for this stage when your dog is feeling like crap. So, for the dogs that are just completely down and out and miserable, this is not the moment to start rehab exercises. That comes later. That's for rebuilding strength and coordination and mobility once the dog is stable. So there are veterinary rehab specialists or physical therapists that you can see. And there are also, actually, I don't even think I have a QR code for that, but there are also Dr. Lori McCauley is a board certified veterinary physical therapist, and she has some at-home programs. I'm just looking to see if I happen to have a code for that. I'll actually put that under this video for you if you're interested. But that's for later. That's not something you're going to do now. Okay, just wanted to mention that. But please don't look at your dog lying there like a wet rag and think, I need to make him exercise. No, we need to stabilize him first. We need to support his comfort or her comfort. And we need to support their appetite. We need to provide pain control. We need to support their immune system. And then when the dog starts to feel better, we can think about gentle strengthening and rehab, but that's for later. Okay, so now let's talk about fever and inflammation, which is probably a thing, especially if your dog has been recently diagnosed and they're laying there looking pitiful. So many dogs with valley fever have a fever. The fevers could come and go, and it makes them feel awful. Fever can suppress the appetite. It can cause them to be lethargic and achy and just miserable. So if your dog looks hot or they're panting and not eating, maybe they're weak and they're acting really sick, you can check their temperature. You can do an armpit temperature. So you can actually take a rectal thermometer or a digital thermometer, and you can put it under their arm and you can check their temperature that way. Their temperature generally runs about 99 to 102.8. So that's normal. So if it's over 103, then they probably have a fever. The good thing is there are herbs that reduce fever and inflammation. So one of them is in my Canine Valley Fever Support Tincture. So I have a herbal tincture that's made to support dogs with valley fever. And it supports them with many of the common symptoms, including fever, but it's antifungal. It's got immune stimulating herbs. It's got analgesic or pain relieving herbs. It's got anti-inflammatory and antioxidant herbs. There are herbs in there that can help with the coughing by helping with the spasm in the respiratory tract. There's all kinds of benefits. And because valley fever is not just a fungus sitting there waiting for medication to fix everything, we need to do more for your dog to help them. So valley fever is a whole body problem. It affects the immune system, the gut, the lungs, the nervous system, and the emotions. So let me pull up my tincture here. This is a wonderful herbal formula, and basically I put all my valley fever dog patients and cats. It says dog, but it's appropriate for cats too. And it's a modification of a human formula. There it is. So the Canine Valley Fever Support Tincture. So this is a great addition to a protocol for dogs with valley fever. And it's safe to use with the pharmaceuticals. And you don't need much because it's a really concentrated tincture. All right, let me pull that down. I'll have all these links below the video also. All right, so a dog with valley fever needs more than one tool. They need more than fluconazole. They need a multimodal approach. They need fluconazole or another antifungal, but they also need pain relief, nausea control, appetite support, gut support, immune support, liver support, good nutrition, and they may benefit from things like acupressure or acupuncture, herbs, supplements, laser therapy, PEMF therapy, massage, gentle movement, or just getting outside. They may need conventional medicine, and they may need conventional medicine and holistic medicine working together. So we use the best tools from both worlds to help your dog recover. And I think one of the most important things pet parents should understand is that when your dog is sick with valley fever, your job is not just to kill or suppress the fungus. Your job is to support your dog. Your dog needs to feel safe. feel loved, be nourished. They need their pain controlled or addressed. They need their nausea eliminated. They need their immune system supported or stimulated because the immune system is tanked. They need gut support, and they need to have moments of joy in their life. Your dog needs comfort. They need you to look at the whole picture. So if your dog is lying there looking pitiful, I want you to go through a mental checklist. Is my dog eating? And if they're not, what can I offer that's more nourishing, more appealing, warmer, softer, easier to eat? Could my dog be nauseous? If yes, what can I do to calm their stomach? Do I need to ask my vet about anti-nausea medication? Or can I try some cool ginger tea or chamomile tea? Is the fluconazole upsetting their stomach? Could my dog be painful? If yes, and they usually are you controlling their pain? Do you have a pain control plan? So I'm not necessarily using conventional medication, but I will if needed. But first I'll add things like homeopathic arnica or tea relief, PEA, CBD, herbal formulas like body sore, and then use physical therapies like massage and acupressure and laser and PEMF. Those all help manage the pain or eliminate the pain. Could my dog have a fever? If you've taken their armpit temperature and they're over 103, they have a fever. Fever can make them feel terrible. And sometimes you need to take them to the vet, if the fever is high. Is my dog just shut down emotionally? If yes, we need to try to bring some joy back. We need to sit with them outside. We need to take them for a stroller ride, or roll the ball to them, or brush them, give them their favorite treat. Give them a little adventure without overdoing it. We need to think about if your dog is getting immune support. This is a huge missing piece. So, is your dog getting gut support? This is also a huge missing piece. Do you have a plan? Or are you just waiting for the fluconazole to make your dog better? Because waiting is where a lot of dogs get into trouble. So, I know people are scared when their dog is diagnosed with valley fever, and I know they feel helpless, and I know they do not know what to do. It's scary, but your dog needs you to move from panic into problem solving. You do not have to do everything perfectly. You do not have to know everything. But you do need to start thinking, how can I help my dog feel better today? Not cure valley fever today, not fix everything today, just feel better today. Can I get calories in my dog today? Can I get some extra fluids in my dog today? Can I make the food more appealing? Can I reduce their nausea? Can I eliminate their pain? Can I help my dog relax? Can I get my dog outside for a few minutes today and give them some more love today? This all supports their immune system, and there's more you can do. In fact, if you need help, I just thought of this. Let me see if I can find my strategy session. I actually have a Zoom call. You can jump on a Zoom call with me and we can troubleshoot some things. And because there are a lot of things that pet parents just don't think about when they're in panic mode. So here's my pet health strategy session. And we jump on a Zoom for 30 minutes and we talk about your dog and we talk about the situation and we figure out a plan and your next best steps. And, and I give you some specific things that you could potentially do for your dog in your dog's situation at that time. So that's my pet health strategy session. So you can use it if you need it. Okay. So this is how we start getting our dogs over that hump. And sometimes just these little things make a huge difference. Sometimes the dog is not ready to give up. And the dog just, feels horrible and they need help. So there are times when you absolutely need urgent veterinary care. So if your dog is struggling to breathe, has pale gums, collapses, can't stand, has uncontrollable pain, vomits repeatedly, has severe diarrhea, or will not eat for more than a day or so, depending on the size of your dog, and they won't drink at all, and maybe they look dehydrated, and you can tell if they're dehydrated if their eyes start sinking back in their head and their third eyelids are coming up a little bit. And also if you pull up the skin a little bit and let go, the skin should snap right back into place. And if it just slowly goes back to normal, your dog is dehydrated. If they have a high fever or seizures, or they're dramatically worse, please do not sit at home trying to try random, home remedies. Go to the ER or the pet urgent care. Go get veterinary help. Those are situations where your dog needs more than a home remedy. But for the dog who is just sick and sad and weak and achy and nauseous and just down in the dumps, there is so much you can do to support them. And this is where pet parents can become incredibly powerful. You are the one who sees your dog all day. You're the one who knows what makes them happy, what their favorite foods are, their favorite toys, their favorite spots in the yard, their routines, their favorite people, and things that make them comfortable. So you're the one who can notice, he ate better when I warmed the food, or she wagged her tail when I took her outside, or he slept better after massage, or she seemed less painful after I gave Arnica Montana 30C. Maybe he looked brighter after he had some bone broth, or she relaxed after having some chamomile tea. Or maybe he finally wanted to interact with the family again. These observations matter a lot. And healing from valley fever is not quick, and it can feel like 2 steps forward and 1 step back. So the goal is not perfection. It's steady support and better days stacking up over time. So when your dog looks pitiful, take a breath and shift from panic into problem solving by asking one question. What is the biggest thing making my dog feel worse right now? Not eating, nausea, pain, fever, sadness. And what is the next simple step I can take today to ease that? Start small. Offer them tasty food, control pain, and do this early instead of waiting. And add a little joy without exhausting them, even if it's only a few minutes outside or a quiet comfort routine. And track what helps. Log this all down. Repeat what works. and let your vet know what you're seeing so the plan can be adjusted based on real feedback. And if you log things in a book, take that with you to your vet appointments. That's extremely valuable, and it's super helpful for vets. So please don't wait at home if your dog is struggling to breathe, has pale gums, collapses, uncontrolled pain, all that. Go to the vet. That's urgent. But if your dog is down and out, there's still hope. And you are not powerless. Look at your dog and ask, how can I help you feel better today? And then do something. All right. So thank you for listening. I don't know if we're going to talk about valley fever next time. I can't remember. Maybe. But I hope this helped. If you need more help, jump on a pet health strategy session with me and we'll problem solve. If you need a lot of help, I have consults. So I have telehealth consults where I actually put the plan together for you. Let me see if I can find that. So I go through all your dog's records and I put a plan together for you. So you don't have to worry about it. And then we go over it during a Zoom. There it is. And, especially if your dog has a real complicated case of valley fever, because I know it's overwhelming. And even early on when they're just feeling like crap, it's still overwhelming and it can get more overwhelming. So I offer telehealth consultations, which is a really deep dive into your dog's history and what's going on with them right now. And I'll give you specific solutions, very specific, and they're tailored to your dog. All right. So thanks for listening, and I will see you next time.